Many leaders in the global health sector attended last week's International AIDS Conference. Among them was Dr. Gomes Sambo, the World Health Organization's Regional Director for Africa, based in Brazzaville, the Republic of Congo. I sat down with Dr. Sambo to discuss several key health issues on the continent, starting with HIV/AIDS.
About 23 million of people living in Africa are infected with the HIV virus. And this is creating a major problem in terms of public health, but also in terms of the economic and social life of people. Governments, communities and partners are involved in this fight against HIV/AIDS. We have some good news about tools that would help to accelerate progress in decreasing the incidence and also the prevalence of the disease.
And now let's talk about the good news. What do you see specifically as some progress that gave you hope?
First is the commitment of political leaders, managers, and public health professionals, civil society at large, in this collective effort to tackle the epidemic. And secondly, some breakthroughs through science. We have improved medicines. We have also new facts about the effect of treatment for prevention. We have also other means that are currently under investigation and that could help us to improve the tools for both prevention and treatment.
Do you think that African governments are doing as much as they should in terms of investment? Recent statistics show that there is more local investments in the fight against HIV/AIDS as opposed to international funding. What is your take on that?
In relation to this, I should recognize that both African governments and the international communities are making more efforts to tackle the epidemic of HIV/AIDS. We realize increasing involvement of political leaders in countries, from heads of state, first ladies, and other high officials in the government. We realize increasing domestic funding to fight HIV/AIDS, and these are good signals.
What about the way the funding is being used? Some people have said that it's not so much about how much is being invested, but also very much so about how it's being dispersed.
Yes, we have problems of efficient management of funds for health in general. You know that in the African context, health financing is depending on contribution of people, government budget, and international financing. But we still need to improve the coordination of all these efforts. We have some fragmentation in the way we allocate funds and we manage funds. We could get better results with the same level of funding. It's a matter of improving the management, being more efficient. Ministers of Health and Ministers of Finance met recently in Tunis to address the issues of health financing. And one of the problems that was identified was exactly the lack of efficiency in the management of funds. But this is being addressed. But for sure that we need more financing, we need more investments in health to tackle HIV/AIDS in particular.
And before I move on to a different topic, if you were to share some specifics in terms of what needs to be scaled up moving forward with the HIV/AIDS crisis on the continent, what would you say should be the priorities?
The priority should be prevention. We should bring together all the efficient tools of prevention and scale up we should also improve coverage in terms of treatment and accelerate the ongoing efforts to reduce and even eliminate the transmission of mother to child.
And coming up on Thursday, I will have the part 2 of my conversation with Dr. Gomes Sambo, the WHO Regional Director for Africa. That's our Africa Health Network report for today. For more health news and developments, be sure to visit our website at africahealthnetwork.com.